Shocking new projections today from the World Health Organization sounding the alarm about the spreading Ebola outbreak, not in the U.S. and Europe, but in West Africa, where it has now killed almost 4,500 people. The Ebola mortality rate has now risen to 70%, according to WHO, and by December, we could see as many as 10,000 new cases per week if the epidemic continues on its current trajectory. Today, President Obama took the international community to task for failing to do its part in fighting the virus.
The world as a whole is not doing enough. There are a number of countries that have capacity that have not yet stepped up. Those that have stepped up, all of us are going to have to do more because unless we contain this at the source, this is going to continue to pose a threat.
But amid all that, there's good news to report here at home. Nina Pham, the Dallas nurse who became the first person to contract Ebola in the U.S., was just upgraded to good condition. She made her first public statement today since being diagnosed over the weekend. Quote, "I'm doing well and I want to thank everyone for their kind wishes and prayers." The CDC is admitting it could have done more to prevent Pham from contracting the disease in the first place, while helping to treat Thomas Eric Duncan, the Liberian man who succumbed to the virus last week.
I think we could, in retrospect, with 20/20 hindsight, we could have sent a more robust hospital infection control team and been more hands-on with the hospital from day one about exactly how this should be managed.
The CDC announced plans to send emergency response teams to assist with any future Ebola cases diagnosed in the U.S. While health officials are monitoring an additional 76 people who may have had some kind of contact with Duncan during his treatment, the 48 people he had contact with before being admitted to the hospital have now gotten through the high-risk period without developing symptoms, as the CDC director tweeted. They'll continue to be monitored for the rest of the 21-day maximum incubation period. Meanwhile, NBC News freelancer Ashoka Mukpo, who contracted Ebola while working in Liberia, is continuing to show improvement at the Nebraska Medical Center where he's being treated. So much improvement, in fact, he was well enough yesterday to send out the following tweet. Back on Twitter, feeling like I'm on the road to good health. We'll be posting some thoughts this week. Endless gratitude for the good vibes. And joining me now is Dr. Mitchell Levy, Ashoka Mukpo's father and medical director of the Medical Intensive Care Unit at Rhode Island Hospital, and his wife, Ashoka's mother, Diana Mukpo. Thank you both for joining me. Maybe I'll begin with you, Diana, if you can tell me how your son's doing and how you're feeling about it all.
Every day I speak to him, his voice sounds stronger and he sounds better and he sounds more optimistic. So we're feeling tremendous relief. Obviously, there have been some very frightening moments over the past 10 days or 2 weeks since we realized that he was sick. But now we're feeling tremendous relief and really believing that Ashoka is going to be better and back home with his family. So there's endless gratitude to so many people who have participated in his good health.
Yeah, Dr. Levy, it seems a testament to both the sophistication of the American medical infrastructure and also the importance of sort of early identification, because we've seen such different trajectories for different people that have actually contracted the illness.
Yeah, I think that's exactly right, Chris, and I think that's why I was so determined to get Ashoka out as quickly as possible, because you're right, early identification and early supportive therapy seems to be the mainstay of the treatment for Ebola right now.
How do the two of you, how are you processing the coverage of Ebola, the fears there are over its contraction, which I think are probably not proportional to the actual threat, but also completely understandable, when your son actually does have it, appears to be on the mend? What do you make of the way that we're all handling this, the way it's being covered, Doctor?
Yeah, that's a very good question. I processed hearing about his illness as any member of the population would be. I didn't process it as a physician, I processed it as a father. And when I first heard via his text that he was worried and he was in trouble, my heart sunk, and I had all the fears that we all have when we hear the word Ebola, and I immediately feared for his life, and I was worried, and I thought, what am I going to do next? And then through the support of a lot of people on the ground in Monrovia, and the State Department and NBC News, I was fortunate enough, and Ashoka was fortunate enough, for us to get him out of there quickly so he could get supportive therapy in a hurry.
Diana, how have you been processing all this?
Pretty much the same way as my husband, from the perspective that when I first got the phone call, 3 o'clock in the morning, that Ashoka probably had Ebola, I was absolutely terrified. I was facing the prospect of losing my son. And all I can say is, you know, at this point, we've obviously been through a tremendously rocky road. But once again, there are so many people. It's been a chain of wonderful people from beginning to end who have really participated and made it possible for Ashoka to get to the Nebraska Medical Center and get the care that he has. So I'm feeling both relief after a period of incredible stress and anxiety and enormous gratitude.
Diana, have you been actually able to see your son? Have you physically seen him, or have you been able to Skype with him? Do you get? Can you see how he's looking?
The only time we actually set eyes on him when he, you know, was from quite a great distance when he was wheeled into the biocontainment unit. But we were able to speak with him over a video cam, so we could see him because he has a camera in his room, and we were in a room next, you know, outside that the biocontainment unit in the hospital in Nebraska, and we were able to look at him on the screen. So, but now I just talk to him on the telephone pretty regularly. So. I'm looking forward to actually seeing him in person and giving him a hug.
Dr. Levy, one of the first things that he tweeted was about having gone through the disease, your son, and thinking his thoughts with the folks in West Africa, where he, of course, was, where he was covering this. And it does make you think about the scale of what they must be trying to deal with when you look at the unbelievable chain of resources that have been devoted to the cases here in the U.S. and all the people and all the expense and labor that has gone into treating those people, what it would be like to be handling that in a place like Liberia or Sierra Leone.
Yeah, that's the challenge. You know, the irony, of course, is all, and I don't mean to minimize it, but what Ashoka has received since he got on the plane for evacuation and then since he arrived in Nebraska was fluids in his veins, which we in the developed world take for granted as a mainstay of hospital care, and simple salt water infused into your blood vessels. And in under-resourced countries, they don't have access to that. They don't have access to the healthcare workers who can put intravenous lines into people's veins. And so what seems like something that's so common here in developed countries is actually a very precious resource.
Dr. Mitchell Levy, Diana Mukpo, thank you very much, and we wish your son all the best.
Thank you.
Wow, those are amazing people. It's not often you see a listicle of greatest quotes from a judicial ruling floating around the internet, but it exists, and it's great, and it's next.